It's a privilege to be here with you on this week that we have in front of us. And we want to study together as how God made us, how we were made to function. As a medical doctor, what do you suppose from a medical doctor to know? He should know how this human being is put together. But unfortunately, I found myself, after many years of study, actually 15 years, and doing my specialty as ENT, I found myself in the private practice, and the patient came to me and put some very simple questions. Why is my ear ringing? Or why is my nose running all the time? Especially I wake up in the morning, the nose runs like something is open, and then after an hour it stops, and then I'm having nothing during the day, but then every morning it is the same. Or other people come and say, well, I have this thing in my throat so that I have always need to do this, you know, I cannot even know. Clear my throat. Yeah, so what can you answer as a doctor when you get these questions? And so I realized, it was now almost 13 years ago, that those questions that my patients wants to know most, I could not answer. I could give a diagnosis. I could say, oh, this is this, and this is that, and that's okay, you have that thing. But where does it come from? Where is the cause for the symptom that I have in the body? And that, you know, in most books that you read in the libraries and in medicine, you won't find a definite cause. Because there is something that we don't know about human beings. And that is, where does the process of disease start? You see, we see the end of it. We see the coughing, we see the ringing in the ear, we see the hearing loss, we see the nose running, we see the, diabetes or heart attack or whatever we see. That's a process that is now here. And we can see that. But where does the process begin? Must it have a beginning? Yes. Can it just occur by nothing? There must be a beginning for every process that exists here in this functional body and in everything that we have around us. So the main issue I find out in my practice was I did not know where is the first step that this disease started. And if you don't know the first step, you are not just a doer for certain things that you cannot understand. So let me give you a short example. As an ENT, I look into the ears of men, yes? And there I see the eardrum. It looks like a heart almost. And this is the right ear. And you look into it, and then you find that here there's a spot that is red, and there are some, we call it granulomas, some tissue that is growing there. And that tissue has no skin. And on that tissue, the bacteria that are everywhere, they can grow. And then they make a certain fluid, and that comes out of the ear that doesn't smell so well. And then the patient comes to me and he wants to know what's going on. And I just, not long ago, I have many of these kind of patients, but there was one that taught me something very interesting. He had this wild, we call it in German, a simple translation from the medical term into a normal term, so to say. It's wild flesh. I mean, it's just flesh that grows wild. It doesn't belong there. It's growing there. And so I said to, I looked into it, and after 13 years almost, you might suppose that I should know why it is there, or? I should. And of course, this gentleman is in his 60s, I think end of 60s, and I have to know, where does this start? I know that, can the drum make this flesh here? Can the drum, the eardrum generate it? Can it? No, we will see the law later on. It cannot. It must come from another place. And this thing comes from our so-called immune system. Yes? That location is in the bone marrow. We will see if we could put all diseases together, we will find that most of them have their step from the bone marrow, from the cells, the antibodies that are made there. And so I know, okay, this comes from another place into his right eardrum. And I need to know how. So I asked this gentleman, I said, you must have something going on in your life. Because he told me it is the third time that this thing occurs. Third times he has this issue. And then I said, okay, so what's going on in your life? And he said, don't ask me. Because last night I woke up at 3 o'clock, I couldn't sleep anymore. He has an ongoing fight with his sister-in-law. His sister-in-law is the sister of his wife, and they are only two sisters, and they have a father, and the father made a testament. Is that a will? Yes, the will. And in the will, he said the older sister inherits the company, and the younger sister inherits the house. Now the father died quite early, and the older sister inherited the company while the company was not yet paid off, and she had to pay also the house was not yet paid off. Now after many years, mother passes away in 2012, and now the younger sister never added anything to that house. They paid it, so to say, and now they say, it's not fair that the younger sister should inherit all of this. And so they try to get the sister to give something up from the house, which is their own part because they paid it. But the sister says, oh, I want to do the will of my father. Yeah, so she doesn't want to change. And so now since 2012, they fight with her, with lawyers, yes. They cannot go to the court because the will is very solemn, they won't have any chance, but they still, with the lawyers, they try to get her to give something back to them. And this time, he said that in about, I don't know exactly the time, but it was about 3 weeks. In 3 weeks, they will have again such a meeting where they will hopefully get her to give something to them as well. So I put my treatment on this eardrum. You know, we have a treatment. We can put there some cortisol, yes, that pushes that back. Usually it works quite well. But in this patient, even though I put the best I had, instead of the granuloma, this wild flesh should go back, it grows. It grows under the full therapy of cortisol. Every 2 days I took out the piece that I put there, and instead of getting it smaller, it grew bigger. And of course he asked me how it's doing. I said, well, it's not changing. It looks like it gets more. It doesn't really work. You know how long that was growing there on that ear? What do you guess? Pardon? So how long was that growing? When did the process go backwards? Well, 2012, the conflict starts. But he has not that since 2012. It comes and goes, especially when he has these meetings. So now the meetings are in about 3 weeks. When does the process get to go backwards when I put some cortisol on it? After the meetings. You see, after the meeting, the process goes back under the therapy and it is gone. Because what happened? Something is there that makes that process grow, and you have nothing to push it back. Because what is more stronger? The body or the therapy? What will always win? The body, because he is under a law of the way he functions, and you will never go against that law forever. You might go for a while. You see, I just met a few months ago a mother that came to me with a girl that is 15 years old. And this 15 years old girl got a ulcer, colitis ulcerosa, ulcers on the colon. If this the colon, then you get ulcers all around. And you ask yourself, where does the ulcers come from? You see, it's probably the same process that is in the ear, you know? Where do the ulcers appear? How do the ulcers appear in that colon? Do they come from the colon? No. There must be a attack from outside, and that attack comes again from the bone marrow. That through the blood and other transportation, these cells and there's a complex way how it works. They come and especially attack the tissue of the colon cells. Now, we have some therapies for this. What are the therapies that we can use? We can make to cover the colon so that the attack from the bone marrow wouldn't come. Yeah, we have our steroids, but then we also have chemicals that can put the bone marrow to work slower, so that the effect on the colon should not be so severe. But all the therapies that we have until now, statistically in about 6 years, the body has won the battle. Because the colon is gone, and you have to take it out. If not, the patient dies. And I had that patient also last year She was 23, and she had to be removed, her whole colon, with 23 years, because this disease was going on since she was 16. So we must understand the human being, how it works, so that we can give an answer to this. This mother has been to how many doctors if the child is 6 months now diseased? To how many doctors goes the mother? She goes to many doctors, and every doctor has some good advice. Yes? And you have some good therapy possibilities. But how long do they work? Do they heal the body? She was for 6 weeks free of any symptoms. And they thought, oh, it works. But then after 6 weeks, all symptoms came back again. Now, it was fortunate for me when I met her to know a solution for her. To maybe able to tell her, look, this is the process where it starts. And if we don't take the process where it starts away, we will not do any good for lasting time to your child. So, not understanding the beginning of the process means you know how much? You work. And I heard last weekend a good example of how our medicine works. There is a river where children are coming from upstream and they are drawing. Yes? And they are drowning. Okay, thank you. And they are drowning, and these people are helping to rescue the children out of that river. And the more they work, the more children come downstream. And they get exhausted. How many can they rescue? And then suddenly one of them starts leaving his position of rescuing. He says he starts swimming upstream. And they call him back and say, why do you come help? The children die. He says, I have to go upstream. I have to go. Where is this starting process is? How do they get into the river? Because there we have to work first so that then finally there will come no one in the back. And this is what happens in disease. Disease is growing more and more. People are getting very early sick. And thus medicine has a solution that really works so that we can avoid it. You see, understanding humanity, I come today to the conclusion we could really avoid most of the diseases that kill us, understanding it. But if you don't understand where the process starts, we will not get to understand humanity. And I was there in my practice, and I could not find why my patients were sick, since I did not know where the process starts. So what I started to do was a very simple thing. And this was God's leading, because, you know, how busy are doctors? Very busy. They make their life sometimes very busy because they call in the patient to come back because they need to live from something. And so they're very busy. And an ENT practice is a busy place, usually, where you have about how many minutes for the patient? Yes, so very less. My fastest work was 70 patients in 5 hours. 70 in 5 hours. So how much can you enter into the life of a person when you see him like that? That's what I was used to work. I was a very fast medical doctor, and in the clinic, when the ambulance was full, the ENT ambulance, and there were some doctors that didn't get along, and they say, okay, call Dr. Mueller. He should come and clean up. So I could clean up fast because this is just gone. Don't look to your human. You don't look what he's doing, because it's just to need the job be done. And so I was used to work. And now I come into my practice and I want to work like I was used to work. And now it happens something strange. And that is, my practice is not as full as I want to be. It's like an angel standing in front of the door, not letting the patients come in. The Lord gives me patience for a half an hour, for an hour. And if no one is waiting there to come to see you, you just talk to him. And so I started to talk. And I took this very simple thing. I took on one side, in all my, if this is the patient, he has maybe 35 years, and it's, let's say it's a female, then I would put here the physical history. So this lady got, with 23 years, she got migraine. And I put on a physical history everything a patient has from his birth, as long as they can remember. And then I said, okay, what is your mental or your relation history? And then I found out there are here events, yes? The migraine started in this lady when she left home. She went very far away from her mom, didn't want to have anything much more to do with her mom. And then after a few days, migraine started, and for 13 years now, it was present. Came almost every week, left side of her head. And she was there in that, and no one really could help her. She went to many doctors. Migraine is a terrible disease or terrible symptom. And the last time she was with a doctor, I think she paid 12,000 euro, and that's much money. It takes $12,000, $15,000 just to get some shots in her neck, because the doctor found out with certain medication he could stop that migraine. And since it helped his colleague at work, she went also to him. But with her, the migraine through the shots got worse. It's like putting something to the body of man, not knowing what you do. Just try it out. Let's see what it's doing. It's like a placebo, you know. You just try it out. If you don't know what to do, let's do something. But if you don't know how to handle the piece that you are going to work with, how can you deal with it? So I took the history, the relationship history, and the physical diseases. And after a few of these patients, and I did this now for many years, I have seen thousands of patients like this, I saw a pattern. And the pattern was repeating in every patient the same. And I could not change it. It was there. I saw it. I even could anticipate it with the time. Because you have the physical that is not subjective. Relationships are subjective. The physical is objective. And you see both. And they both are there like a mirror and an image and a mirror, yes? So I got very curious. What do you think was the problems that my people had that they became sick? What was they evolving around? You see, I got here events. like I shared before. So what were all events going around? No, that's the result. But what is the issue? Why is this gentleman so upset upon his sister-in-law? Why does he fight with her? No, the anger is the result. But why does he fight?
He wants some money.
Well, it's not about the money. So what is he wanting from his sister-in-law?
For her to understand.
Yes, but what to understand? Righteousness. Yes? Justice, righteousness. So she's doing injustice that she does not take in consideration that I pay the house. Yeah? It's injustice. And I was at the beginning of my practice, I took my patient, I took the time to talk to them. And the Lord brought me on some days all dizzy people. So you have a day, then almost every patient has dizziness. That's interesting. And then you explore their life. And what do you find? The same, similar situation. Then I got the patient with the thyroids and all. It was fantastic to see how I was learning step by step that there must be something in their relationships that goes wrong. So what is about relationship? Why do we have relationships? What's the purpose of relationship? Love. Love is the purpose of relationship. And I didn't learn in medical school anything about love. You know that? It's amazing. The first and greatest human need I discovered after 2.5 years. This was 2.5 years. After 2.5 years, I could not let it go anymore. I said to myself, and I wrote it down in my mind. I said, the human being, his body needs love to function well. Needs righteousness, needs truth to function well. But I could not understand it. I went home every night and shared with my family the stories that I had. And they were laughing and saying, oh, how? I said, well, look, it is love that makes people sick. And we had 14, 16, and 18 teenagers at home. I mean, this age, so three with this age. And so they were just challenging me and said, your observation might not be correct. Everyone has relationship issues. How can you say it's from there? And so their challenge was good. I said, I must put this on a very solid base. I said, I must know if their love is needed for the body, I must know how that works. Because if you don't know how it works, you just are there and you can say it, but you have no solid ground. And I'm a German, but not because I'm a German. I'm a doubter by nature. For me, if things are not 100%, I don't take them. You see, I never enjoyed statistics. Never, ever. You know why? Because they don't put my feet on 100% security. And I know in my spirit, in my mind, I have a need of 100% security. I cannot say 99% or 1. And I share you a patient's history. There is a surgery we do in the ear, replacing one of the ear bones and the stapes, yeah? Because of otosclerosis, we replace the stapes, and the chance that you lose your hearing, what's that expression? deaf, the chance to get deaf by that surgery is 1%. Now, what do you think, how great is the danger for you if you go into that surgery? Great or small? You would think it is small, but it is 1 to 1. And I had that patient with me sitting in my practice. She went to do the surgery and she got deaf. And she was devastated. Because you could help also with a hearing aid to go over that bridge and you still hear something. But now she was very fearful. She might not hear at the other ear anymore or anything. And so she was devastated. Because she thought the risk is just very minimal. But you are the one individual. And if it's you, that 1%, how much risk do you have? You understand? The risk factor is a lie. It confuses people. You can never say for a group it's the same thing for an individual. But we take the group statistic and put it on the individual. That doesn't count. That's why I never liked it. I discard statistics for me, because they are not really 100%. They might be well to see something and some directions, but I cannot stay with risk factors. I must know the 100% thing, because only on that I can stand. And since I'm a doubter by nature, I put everything to doubt. I doubted for years, even though I was grown up in a Seventh-day Adventist family, that God exists. Now, I cannot doubt anymore, because I have an evidence that I cannot change with my thinking. And that evidence is the need of love in the human organism. And what is love? Spiritual or physical? What is love? Is love anything like chemistry? Is love oxytocin? Is love a chemical? Of course not. Is righteousness a chemical? Is righteousness a chemical? Is truth a chemical? No, I want to make sure that we understand this is something pure spiritual that has an effect on the physical. And I don't know how. How can it be that unrighteousness makes people to jump from a block or to kill themselves or whatever they do? How can it be that this body gets sick and gets ulcers in your stomach when you get into a love issue? So love is something pure spiritual, has nothing to do with your emotions. Hope you get it. The American or the English way of speaking is very confusing. You see, evolutionistic speaking, the limbic system, we will see that in this program, we will see that the emotions come from the center of the brain. And the evolutionists say the center of the brain was before the periphery of the brain, the cortex. And so they say emotions are more important than thoughts. That's why we have today the idea of emotional intelligence. And when we speak about love, we speak about emotions. But this is something that is very specific, made for us to confuse the mind. That's why emotions are the result of thoughts. Yes, they can also induce thoughts then again. Yeah, it's a circle. But the first step is always a thought. And a thought is spiritual and not physical. But the emotions are all physical. So emotions are after the thought, and they are a result of what one person thinks, and we will see in his heart, in his subconsciousness. So love is not oxytocin or whatever we think we have in this our brain as chemicals, as hormones, as neurotransmitters. Love is nothing like that. Love is spiritual. And now, how can a spiritual thing work together with the physical? And how can it affect it? So this was my question. And I cannot put that on a ground that is just on observation. Observation helps us. But I need to put my observation under something I cannot change with observation. If not, I might be fooled in observation. You see, we can put 5 people to observe something, and how many results do we have? Yeah, we can have 5 results. So observation is subjective, but if you could put that observation on a law, then your observation is not anymore subjective, but objective. That's how I started to do the things, and how I still do it until today. If you don't have a law for what you argue for, then I don't take it. Because I only can trust the law as being the truth. Results do not convince me. If someone comes to me and says, oh, I have headaches, and I took this, now my headache is gone. I say, okay, did you cure the cause or the symptom? Yeah? What did you do? Let's see in an hour, in a day, in a year, what will happen. And let's see the whole body, what will come out. Because there is no such thing that I should go after when someone says, oh, this works. This must be the cause. I say, okay, then show me the law. So is migraine coming because you don't have some shots in your neck? Is that the cause of, yeah? So I hope you understand the point. The cause must be very clearly exposed, and then the therapy is something different than the cause. Yeah? The therapy keeps with the symptom, but the cause keeps with the why. Why is the symptom there? And I want to put all my judgment not on my own, because if you put the judgment on your own, you might be very, very deceived by your own way of looking to things. That's why I put my judgment on a law. And I started with, that's why I call my presentations the law of life, because I don't want anyone after all the presentation to become believer in me. But I want everyone to come to be believer or to realize the law is the same, and you can judge it without needing to believe me. You see, you can see 2 kinds of sciences that we have in the world. The one science makes you to believe. The other science, that is the true science, makes you to be convinced. So faith-based science means you cannot go after that information to prove it. Yes? You can just, oh, he's a scientist, so he must say the truth. Hey? So you're not able to prove what the scientist says because he brings you a statistic. He brings you any study. Can you do it at your home? Can you just say, okay, let's do the experiment at my home? Yeah? So you cannot do it because you are dependent on someone to believe him about what he says to you. That's not science that I would say would help us. The science, which is real science, is taking and studying the law and see the laws of nature. And I'm convinced if we at our universities would study the laws, not results, not effects, but the law that is at the bottom of everything, we would come all to the same conclusion, because the law is the same for everyone. But you see, the law brings out thousands of effects, and the breaking of the law brings as well thousands of dysfunction. But if you don't know the ground, you go guess by effects. So I hope you understood the point, that we want to study laws that we can rely on, that we can say this is so, not because I believe it's so, not because Horst or some doctor says it, because the law is so. And then you don't need to believe me, you just see that the law is there, and it's very simple. So I never want to do a lecture where I make people to believe what I say, in the matter that they should cite me. I just want them to think by themselves and prove by themselves what is so, what is the truth or not. Because the laws are simple. The laws that govern our life are as simple as we can imagine it. So let's take the first of all laws that I came to see. It says, there is for every effect, there must be a cause. Why must there be for every effect a cause? Why is this law so absolute? Is it absolute, this law? Does it give, is there any exception? No. We might take one exception, that would be God. Yeah, he does something without a cause. But everything that God created, where we see an effect, it must have a cause. So, why? What is the law telling us? Why can I not say this eardrum or this colitis comes from accident? Comes from chance. Can it come by chance? Can it come by chance? I hope not. There is nothing in our body that can come by chance. There is nothing in the physical world that is able by chance, because every chemical reaction is fixed from the beginning if it's possible or not. If it's breakable or not. Those are things that God put there. There's no change in it at all. Everything that has an effect must have a cause. And the why is this. Because, one, everything that functions needs energy. Do you agree with that? Needs power. Without power, how much can be done? Nothing. And then the second point of the law is, where does the energy come from? All energy comes from outside of that function. So since the energy always must come from outside, it's evident that there must be for everything, for every effect, a cause. If the energy would come from inside, if the power would come from inside that element, then the power, the effects would be without a cause. But we know that not in the atom, the power that we have in the nucleus of the atom, does it come from the atom or from outside the atom? It must be from outside. Science says they don't know, but we know better, do we? But they know at least that it does not come from the nucleus. We can use it from there, but it's not from there. So, understanding this, you understand one principle. Where you have the effect, you cannot have the cause. Understand that? This is not so easy to think, so I repeat it. Where you have the effect, you cannot have the cause. So if you have a bump in your car, a dent in your car, can it come from the piece that the car was made out? Can it be from there? No, because it must come from outside. You see the impression in the car, in the metal. Yes, that was the word I was searching for. You see the dent in the metal, but you cannot say, let's understand the metal, why it got dent. Would it make sense to take the metal and see, oh, it might have done it by itself? It wouldn't make sense. So the same thing. When you have breast cancer, can the cancer come from your breast or not? It cannot come from the breast. So taking out the breast just, would that help? Well, it helps at least for a while sometimes, but we must know the cancer of the breast does not come from the breast, because by law it's not possible. Not by what you see. Because, by what we see, we might say, oh, well, it comes out of the breast, so it must be, and it's breast tissue where the cancer starts. But is the point of action from there? It's not possible. If I have a person that gets his tonsils are infected, and they come and then, because the tonsils are so easy to be removed, in a few years ago, everyone got his tonsils removed in his childhood. At least in Germany it was so. Well, let's take them out. They're easy to take out, and so you get rid, because if the infection goes to the heart, then you get heart issue and rheumatic fever and all this. And so we took them out. Today we are better. We don't take so many tonsils out than before. But what do you solve if you take the tonsils out? But did you solve the problem? Because people come, and the indication in Germany is to remove the tonsils when you have at least 5 to 6 times a year an acute tonsillitis, an acute infection. Then you can take them out. So they say at least 5 to 6 times. If you have only 2 times, then they say, oh, that's normal, so we don't remove them. So the person gets it so often, and I also had this disease from my childhood until I took them out. I was about 26, 27, I don't know exactly the age, and I thought I would get rid of the problems. But you know what you do when you take out tonsils? Do you remove the cause? No. It's by law not possible, because the cause is not in the place where it has the effect. That we must put in our heart, in our understanding, because it's a basic thing. It is not possible. Where the effect is, the cause shall be. The cause is always elsewhere, from outside. And I had this experience in my practice. I'm so happy that I learned all this by patients that I had before me. I don't tell you stories of what I read, because I study myself. I want to see the things for me myself. When you remove the tonsil, the cause is not removed. So the effect in the body must change to another place. When you remove the colon, the problem is not solved. It must go then to another place. But until then, your bone marrow needs to be changed. And then it might pass a year, 2, 3, until you get another symptom from the same cause. Have you ever wondered why patients have so many, some of them have so many diseases? The patients that had the most diseases were my favorite patients. I mean, as a study element, you know, if you have just ringing on the ears, then okay, but you have the ringing on the ear, you have cancer of this, then you have hypertension, then you have diabetes, and you have them all. Then you say, how does this patient get them all? Because some say, oh, I always cried here I am. So they took all the diseases on them. But how does it come that they have it all? Because, I mean, it's enough to have one big disease. Why should you have all of them? And there might be even depression as well there. So here, I had to understand that when you just remove a symptom, you get another symptom in another place. And you know, I read that in an old book. I must tell you, when I started first in my practice, I was reconverted. I was just not even a year. Yes, I was reconverted. I was an Adventist all the time, but the Lord had mercy with me, and I had a reconversion in 2003. And I was very eager to know from the Lord the things. And I'm a person that asks questions. And I said, Lord, you put me now in a practice to work, and I want to know what book shall I read to be prepared for this work. And the first idea that came was Ministry of Healing. And I knew the book, but I never did study it really. How many of you have read in the book something? Okay, so I promise you, you should study the book, and I still read it. At our worship morning, I read from it, and we had it for years as a book for the worship, because it is so concentrated. If you want to know what Ellen White wrote about humanity, about salvation, this book says it all. It is all in it, but it is in a very compact form. It's like you take the concentrate and put it all there. And in this book, it is said, when you do not remove the cause, but you just give some therapies, you move the symptoms to another place. I did not know how that works, but when I had the patient, I could see it by my own eyes. You give a medication, and then you have side effects. Why do you have side effects? It's just because the problem is not solved. Yes, you undo one effect, but you get others because you have not taken the disease at the place where it starts. And I'm okay with therapy, but it's not enough. I'm okay even with surgery. Sometimes you must do surgery, but you should take care of the cause as well. So when a person takes out his tonsils, and I had this young man, he wanted to take them out. I said, I want to get rid of them. And I said, okay. I wrote him a prescription. He went to the hospital. And after about 9 months, he came back. And I said, oh, how are you doing? And he said, oh, I'm very fine here. No problems. And he was very happy. And I was very curious to see what happened. Is there any other symptoms that came after that? And I don't know why he came in my practice, but I talked to him about this, and he said, well, he has knee problems now. And I said, okay, here it is gone. And I can give you numerous examples. You do the surgery on the nose. Even while you are in hospital, you get dizzy. Yeah? And now your surgery, your nose is not blocked anymore, but now you have for 2 years dizziness. What is better? Yeah? Or you remove your knee, you replace your knee with another thing, and then you get asthma while you are in hospital. So we cannot play with nature. We cannot. We just play against ourselves. Where if we just do things because all are doing it, because we think that's going to work, we are not very smart. I learned that nature is to be feared. You have to know what you do with nature. Yes, that we are living under grace is a very good thing. If we were not living under grace, of course, we would be dead for long. Yes? But under grace, God gives us the possibility to understand these processes. But if we don't go by laws, we are just very confused. So take this thought for tonight as one of the basic thoughts. Because we will see another law that is even more basic than this. But they are all in harmony. You see, the laws are also governed and are hierarchical. There are laws that govern everything, and there are laws that govern just a part of something. But there is the law of cause and effect governs how much? Everything. So it must be there at the fundamental of all laws that God made. But there is one, and we will see it's very connected to this, that is even more basic than this. But the law of cause and effect says, by all means, where you have the effect, you have not the cause. So let's get that. We have the energy in the atom, but it does not come the energy from the atom. It's not possible. Science knows that. The scientists postulated this law. Yeah, they said it. No matter how we call it, first thermodynamical laws or whatever, how we call it doesn't matter in the end. It is that we need to understand. So, when you have an injury, would you say, "Oh, your skin is wrong"? No, you say, "Well, what injured the skin?" So where the effect is, there is not the cause. So this, if we would implement only this simple law in medicine, how much would it change? I tell you, it would change a lot. We would not be focused when a person comes with his knee issue. Would we look to the knee first? We would look to the knee, of course, and we would take care for the knee. But then we would say, "Oh, let's see, does this knee make itself sick? Can it be?" And then you have to inquire, is it an injury? What is it there? What happened? And then you will find out, oh, there's no injury, but we are missing the meniscus. How come that he disappeared? Or he's torn, he's in pieces. How does it happen? Well, yes, we can remove it or we can do something and the symptoms goes away. But we must know the problem is not in the knee when you have a knee problem. When you have a heart problem, your problem is not in the heart. This is such a simple law. And you see already how difficult it is to follow, or is it or not? Because we're not based in our thoughts to see the cause behind it. We just are willing to remove results. We are wanting to take care of the thing. And that's fine. I'm not against that. But it is not enough. And we are not good doctors. And I'm going to share this at the end. I never want to become a doctor. You know, I'm a doctor here because the Lord had to help me through my wife, because I was an obedient husband, to become a doctor. She didn't want to become the wife of a pastor. I always want to be a pastor. From my childhood, since I know, I said, I'm going to be a pastor. That was all I wanted in my life. And here my wife said, no, pastor, you need to be a doctor. So I obeyed. And I know today it was God's leading, because he wanted me. You see, pastors sometimes are just on one foot, because you have just a theological approach. And you don't have also the physical approach. And if you are a doctor and you don't have the theological approach, you're just one foot also, because you jump around and you don't get further. But if you have the laws of the physical and the laws of the spiritual, and you combine them because they are combined together, then you have 2 feet, and then you can stand. Understanding these simple laws of nature and how the body functions, I can understand today the gospel in a very nice thing, and I'm not confused about it. You see, Ellen White says in her first, in the book Steps to Christ, revelation and nature, or nature and revelation are the expression of God. So we need to understand that. We need to learn from both. If you're just a Bible reader, you won't get it. You must have the laws of nature to see and work with them. If not, you're getting confused. So I became a doctor without wanting it from my childhood. And I'm a doctor today, but what am I more? I'm more a preacher. Because the issue of life is in the mind, not in the body. Yeah, so I don't teach your bodies now something, do I? I teach your mind something. So but you cannot understand the one without the other, and they cannot function one without the other. So we cannot separate them. The priest is also the doctor. The theologians should be also medical, and medical should also be a theologian. If not, we cannot really grasp the things, and then we get confused. But with 2 feet, with 2 unchangeable things, the Word of God and the laws of nature, we have some tool that will guard our minds to be focused, directed, and balanced. Of course, not from the beginning, but in time. For me, understanding the laws that govern nature, that we are under, because the laws are an image of what God made, it gets me to be more and more balanced, because we all have some tendencies to extremes, yes? But if we understand the laws, they bring us reason, they bring us knowledge, they bring us wisdom. And when I was a child, we used and liked the Bible verse that says in Psalm 119, 100, it says, I am more wise than the elders, yes? Because I keep thy commandments. So what makes us wise? It's the understanding of the law. I cannot underline this more than I can do it. Understanding the law of nature, which have no chance to change. We will not get fooled in these days, neither with our diseases, nor with the way we think. So there must be for everything a cause. And now I have here that I don't find a physical cause for my body thing. I don't find a physical cause that the ear gets with the wild flesh or the granuloma. I don't get a physical cause for the ulcers. Because how can I grasp it? What is happening? But if I go into the history, I find a spiritual cause. And then I say, okay, how does that fit together? So we need to find the link between the spiritual impact on the DNA, on the cells. We need to know, how does that work? Do you think God made enough provision that we should know that? Do you think that? I must tell you, the book Ministry of Healing reveals it all to us. But it won't reveal you if you read it. And it would have never revealed it to me if God would have not brought me, in the morning I read, and then I had the patients. And then boom, you see it. But if you have just the reading and you don't have the practical to it, you cannot see it. Or you might not be able to see it. But now, maybe because I'm a slow learner, I needed the practical as well. And so in the practice, I saw the book and I saw the real life, and I could compare it. And you know, in Ministry of Healing, I discovered for the first time that love is the power for our body. You know that's written there? In this book it says, love is a vitalizing energy for all our beings. It gives power to the heart, to the muscles, to the brain. So love, how can it be? So she writes it, and God made provision that we should know it, but if you just read it through, you won't see it. Do you think in the Bible is written everything that is enough that we should have a healthy life? You think or not? Yes. Yes. So it must be then in the Bible already everything that is needed for us today to live a healthy life and be a different kind of people. Because God deals with us for thousands of years now, yes, for 6,000 years, and He puts it all there for us. But it is for whom? For who is willing to study. And who is willing to compare not only Scripture with Scripture, but how it reveals in the physical life, how it reveals in nature. And having both sides, we are very balanced and sure for what we say and how we treat people. So we will study from time. This was a long introduction, but it's a very important introduction. And we must understand, and we will see step by step, where the beginning of humanity is. I like it that I know today where is the first step of human thinking. Where does it start? And if at that point everything is right, all the chain of action is right. Yes? What comes from the thought? Of course, I can get hit by a car or something, yeah? But we don't discuss that. We want to understand the functional way. We want to understand how love impacts life, because this is the most important thing that I came to understand in humanity. Or is it not in your life? Any here he says that anything else than love is the most important? No. We are striving for love. Love is, if God created us, then must it not be evident that we should work by love? If God is love? Would you work, would you do anything to work if you are the power of love? If you are the energy for everything, would you make that things should work without you? No. So God made us to live through Him. Physically, not only spiritually. On the spiritual level, we understand. Yeah, we understand. On a spiritual level, we could say bad behavior is a problem, a hurt person. But if we find a physical thing, we won't say the same. But it's when we will see the function coming to the same or has the same beginning. So, understanding how love works for your stomach or for your brain that goes through all the body, that leads all the body, is our theme. Because this is more, Ellen White says, that 9 out of 10 diseases come from here. So that's why this should be our first study. This should be our focus. How does it come that love governs my liver? And when there is a lack of love, the liver gets problems, or the heart gets problems, or the ear gets problem, or anything in our physical life gets problem. So I hope to see you back tomorrow night and each night to come and see. It is simple, sometimes too simple for us that we think it has such an impact. But we can all prove it ourselves. We don't need books to read for it. We can just prove it if it is so or not. Any questions? Because I'm always open to have questions. I know there's not much to question tonight, I hope so, but we will have maybe more questions along the way. And I hope to the end of the lecture we will have no questions anymore about how love works in the body. I hope that that question is settled, and then we can go on practicing it. Amen? Wish you a good night.